These days, patients can actually reshape their knees in less than an hour. Plastic surgeon Dr. Thomas Loeb performs liposuction on these trouble spots as well as others. He joins us now with one of his patients, Diane Ladden. Good morning to both of you. Welcome.
Thank you. Thanks for having us.
Plastic surgery and liposuction have been around for a while, but all of a sudden there's this new interest in working on the knees. Why?
Well, it's kind of interesting. I'm an expert certainly in facial surgery, nose facelifts, eyelids, even breast surgery, but liposuction still remains the #1 procedure in this country and in my practice. What's happened over the last few years is that technology's improved, instruments have gotten smaller, patient demand's gone up, and surgeon experience has improved. So what happens is patients now come in, instead of just asking for the big areas, which are the outer thighs and the hips, they're now asking for fine-tuning, like of the jowls or the knees.
Now, Diane, you've had a good experience, obviously, with it. What was it like? Did it hurt?
Well, it was a little uncomfortable the first week, but nothing at all difficult. And I'd been pretty well schooled in what was going to happen. You'd been very precise about what we'd feel like and what would go on. So it really wasn't a problem at all.
Now, before we get to the results of your actual liposurgery, let's take a look at some videotape, not of you, but of someone beforehand who wanted to get this done. Now, that would be on the left. That's the before picture, right? This is pretty typical. Women come in and say, I got this knee thing going on. What can you do?
Right. I mean, that's an example that it's not a terrible knee, but it's certainly got some extra tissue there, and there's a bone there, but outside that bone there's enough fat and thickness there you can actually pinch your own knees and find out whether you have that. If you can pinch and you have about a 2-inch pinch there between your fingers, you can tell that you could improve that area and make it thinner.
And then on the right side you see that they are, in fact, much thinner.
Right.
And Diane, you wanted to show these knees off, right?
Well, I think it's the least we can do. Like I have enough rope here, yes.
So it's, what, liberating? It feels a whole lot better? Looks a whole lot better?
Yes, and also I think one of the great points about the surgery is it isn't just one section. It has to be sculpted. It's sort of an artistic sort of surgery. So if you can start with the knee and then work on the leg, you get a much more attractive final leg. And I think that was the most exciting thing about it, is it really is sculptural as well as surgical.
How long does this whole thing take? What's it cost?
Well, it depends on the areas. I mean, frequently liposuction of a knee or a jowl is done at the same time we're doing liposuction of other areas. But a knee alone probably takes just about 20 or 30 minutes. Part of it's getting the patient comfortable, giving them enough anesthetic so they're sedated and comfortable and not going to have any pain. If a knee-only area is usually $2,500, $3,000 in that range, but frequently people are doing other areas, and a knee may be an area that I suggest to them that they didn't even realize could be done before.
Side effects?
You'll have some bruising, of course, for the first few weeks. You'll be able to go back to work the next day if you're just doing knees. If you're doing a whole body, it's probably going to be 3 days. And the skin should retract very nicely. That's something that I discuss with your plastic surgeon to see whether you're really a good candidate to have it done.
And as you say, it's well worth it, right?
Absolutely.
Thank you for coming in, Diane, and Dr. Lowe. We appreciate it.
Thanks for having us.